All right, so first I just want to welcome you folks to our lung school today. This gives you an opportunity to ask questions. Hopefully we help to get rid of some of your anxieties. And we just want you to be comfortable and feel free to ask questions as we go through. Now, a couple of things I like to get out of the way. Actually, just one little bit of information, just so that you know. We've been doing this program now for 16 years, and only a couple of years ago we thought we would just start keeping tabs on how many patients we're seeing in a year. And since 2017, we have seen 404 patients. So that's quite a few people that we're seeing. Okay, so that's just a little bit of information on the side. A couple of things that I also like to get out of the way for patients, because the things like parking. Parking is, you can park outside here. It is expensive if you're there by the day. So if you want, you can also buy passes. The passes are $40, I believe, for 5 days. And I don't think you would need any more than that. Most of our thoracic patients are in and out in 2 to 3 days, so you've definitely got enough time with the 5. If you choose, there's also parking across the road, $5 for 4 hours, $10 for 24. And another spot down at the lights, $5 for 24 hours. And I just always stress that just be aware that you have to be able to get across that street, and it is pretty busy. So that's important. Also, for anybody who's out of town, if you are coming down, say, the night before, or even sometimes if patients live a long ways away, they stay the day they're discharged, just so that they have an opportunity to sort of be closer to the hospital that first while. If you do choose to stay in a hotel the night before, please make sure that you mention that you are a patient here, because the families get a discount at the hotels. So that is important, okay? Now, just a few things about getting ready, and I really want to stress this. In regards to your surgery, sometimes I'll say to people, you know what, don't be you just got to sort of not think about the surgery right now, because you need to focus on what you can do to help yourself be as healthy as you can coming in for the surgery. You really can't do too much about the surgery. That's your surgeon's job. But there are things that people can do just for themselves. For instance now, in regards to your diet, please try to be as healthy as you can. I know that might sound like it's not a big deal, but it is. Things like eating, if you like red meat, eat red meat. I know there's lots of talk about not eating too much, but when you're going in for a surgery like this, that's a positive thing. You know, red meat has iron. Iron helps your hemoglobin, and all of that works in your favor. Also, there's dark fruits and veggies. Again, same thing. They're very good for you. They have a lot of antioxidants. They help to boost your immune system, and again, that's important. Just very simple things as well. Things like, and I'm telling you, you will hear this from the minute you wake up after your surgery, walking, exercise, all those things is so, so important after you've had lung surgery. And even at home, practicing just walking around. If you can't walk a long distance, we ask that even if you try to walk around, you know, downstairs in the morning for maybe 5 minutes, walk around upstairs, just do that 2 or 3 times a day. That is very good for you. It helps you to get more oxygen into your lungs, and it just benefits you. Okay, deep breathing and coughing. This is another thing that is very, very important. Deep breathing and coughing, because after you have your surgery, you will have a chest tube in, and that is because your lung on that side, whichever side you have surgery, that lung will have collapsed down, and we need to help it expand again. Things that you can do to help that. Small things like taking a deep breath, okay? Like this. That's the kind of cough we want. We don't want coughs like and I know that you're thinking it will be hard after the surgery, but I want you to practice that at home because it's very important. okay? Leading up to the surgery, this is something that is really important for you if you can do it. Now, I know that there's some issues maybe you might have, but in regards to things like your diet also, 2 or 3 days before the surgery date, I want you to make sure you increase your fiber. All right, I don't want you to do any major clean out or anything, but I want you to try and make sure your bowels are moving a little more often than usual. And that's because after the surgery, we are going to be giving you narcotics or pain medication. It doesn't matter who you are, and it doesn't matter what the drug is. Narcotics slow your bowel. Slow bowel will make you constipated, and that's something that you don't have to have if you kind of prepare yourself as you go beforehand. Also, if you are having an issue when you're in the hospital, make sure to tell the nurse. The nurses in that area will definitely look after that for you. Okay? Now, is anybody here today diabetic? Nope, I don't think so. Okay, and anyone taking blood thinners. Now, I know both of you take the baby aspirin, but you've both stopped that, correct? Do you take, no? Okay, and any natural herbs or vitamins also? No? If you take anything like that, we also ask you to stop those things, okay? All right. I'm just going to get you to turn now. Take your books. Now, this is your package that you're going to take home with you, okay? And I want you to turn to page 4. Now, this is just a little bit of information for our patients, but I think it's very important for you. Everyone knows that we have 2 lungs, but not everybody knows that we have 1, 2, 3, 4, 5 lobes of lung tissue. Now, that is very important for you to know, because even if you have to have a lobe removed, you still have 4 out of 5 lobes left. The other thing is, if you look on page 5, you're going to see wedge resection, segment resection, and lobectomy. Every single person who has lung surgery will have what we call a wedge. That's the smallest piece of tissue that you can take, and they take that. You're asleep, so you don't realize this, but they will take that small piece of tissue first. They send that down to pathology. Pathology looks at that and will call back to the surgeon and say, yes, the edges are all clear, that's fine, or yes, go ahead. Let's take a bigger piece as you thought to make sure we get everything, okay? So it may mean that you'll go from what we call the wedge to a segment, or it could be the lobectomy. It just depends on what the surgeon says. Now, if you turn to page 8 and fold page 9 in half, you're going to see 2 pictures there. One, the man will have 1 incision. Probably it can be anywhere from 3 to 4 inches. I don't like to say how big the incision is because everybody's different. And also you see where they have 3 small incisions. The one incision is called a thoracotomy incision, and the other incisions are called video-assisted. Video-assisted thoracic surgery is less invasive, and it's just they make 3 small incisions. They go in and find the spot, then they'll go in and remove it. The 3rd spot is for our chest tube drainage set. Every single person, whether you have a thoracotomy incision, the one, or the video-assisted, will end up having a chest tube. Now, the reason for that, the reason is that the minute we make that incision, that we've changed the pressure inside the thoracic cavity, so the lung on that side will collapse down. That's all right. The surgeon can get in, do his surgery, take what he has to take, but now on the way out, he's going to slip in a catheter. A smaller catheter goes in to the thoracic space, and the end of that is connected to our chest tube drainage set. What this is doing, it's going to drain off any drainage there is. If I cut my hand, I bleed. We're going to make an incision. We go through some tissue and remove that lesion. So there will definitely be some drainage. The whole idea is to make sure that we can drain out the drainage, but even more importantly is draining out that air. When all the air is out of the thoracic cavity, up pops the lung again. Okay? And again, some people will say to me, well, how long am I going to have this in place? Each and every one of you are different. Everybody is a different result, okay? Now, I would say, quite honestly, the majority of our patients, I would have to say probably 80–85% of the people are out of here probably within 2 to 3 days. Also, whenever the surgeon has told you 2 to 3 days or 3 to 5 days, I do like to tell people, always sort of focus on the longer time rather than the shortest time, because you're always happy if you can go home a day early. But even though he told you might be here 3 or you might be here 5, if you focus on the shorter time, then you get down on yourself once you have to stay another day. Okay? So that's just for you to think about. Now, whenever you do go in for your surgery, and this part is really for the family, probably most of these surgeries, they can vary anywhere from 2 to 4 hours, but the majority of them are about 2.5 hours. Then you'll be in recovery room for approximately an hour and a half. From there, you're going to go upstairs to a unit called SACU. So you won't be in like a separate room. You're going to be in a big, large room like this. There are 6 or 7 beds. Every person that has lung surgery will go to that unit. They will also, when they wake up, so when you wake up, you're going to be hooked up to a heart monitor. You'll have this chest tube drainage set in. You're going to have intravenous's in. You may or may not have a catheter in. It depends on, you know, what the surgeons feel at the time. So that's important for you to know, so that you don't wake up and think, oh my goodness, something's wrong. Nothing's wrong, that's just routine. That way it's easier for us also. We can immediately see your blood pressure, your pulse, your oxygen level. All of those things are very important after the surgery. Now, also for the family, as much as I say, after that hour and a half, they go up to SACU, step down acute care unit. When you go upstairs to see them, there's a very good chance that you're going to be asked to go and have a seat again in a waiting room, because when we move your family member from recovery room upstairs to the unit, you know, we're moving a lot of equipment and the patient. When we get to SACU, we have to get them over, position them, get them comfortable in bed, check their incision, and hook up all the machines, okay? So that's important. They will come and get you as soon as the patient is ready. I do ask you to maybe just bring the immediate family to visit. Don't bring a whole lot of people. And I always say, you know, think about this as, you know, think about it whenever you're coming, because you don't want a whole lot of people around. You know, the more people in and out all the time, the more chance of infection. So just keep it to minimum amount of people. Also, I also ask you to please make one person who is the designated person to call. You want your nurses looking after the patients. You don't want your nurses running to answer those phones that are ringing all the time, okay? So one person in the family can call and say, how is he doing or how is she doing? And they will give you whatever information you need, okay? So that's important for you to remember. Now, what happens, and I think a lot of times, a lot of people feel, well, I'm having lung surgery, this is probably, I'll be in bed, I won't be able to move, and I have this tube in place, I'll be, you know, really stationary. Not so. With lung surgery, if you have your surgery first thing in the morning, there's a very good chance that you are going to be sitting at your bedside maybe that evening, but if not that evening, definitely the next morning. People are sitting at the bedside, you'll have your breakfast in the morning, you'll have some AM care, and then you're going to be sent down for a chest x-ray. You may go down for the chest x-ray first, but that's sort of the routine that happens. Quite honestly, I don't think that there's not too many people who have their lung re-expand that next day. Some do, but the majority of people are about 2 to 3 days, okay? When that lung has re-expanded, and as I say, you're going to go downstairs every morning for a chest x-ray just to make sure. So we'll say maybe the second day that lung has re-expanded. They'll phone the surgeon, let the people in SACU know that the lung is re-expanded and we're going to be able to remove the chest tube. I also say to people, please don't work yourself up into a big state about having the chest tube out. Whenever the chest tube is in there, it's not hurting. You're aware that it's there maybe, but it's not hurting you. When it comes out, it's sort of like a and it's gone, okay? When the once the tube is removed, then the surgeon will suture that incision, and they do suture it with dissolvable sutures, so you don't have to worry about having any staples or stitches removed, okay? One of the things that I do ask you to do today when you go home is I want you to call your family doctor, and I want you to make an appointment for 7 to 10 days after the surgery. Why are you seeing your family doctor after the surgery and not the surgeon? You're not going to see your surgeon for at least 4 to 6 weeks. And in fact, I'm sure probably most of you have an appointment for that time now. It takes time to get all the results together, but we still want someone to be looking at that incision, making sure that it's clean and dry, okay? So that's why we want you to see the family doctor. That's about 2 weeks, thereabouts. The other thing is that we kind of make you do that because when you leave here, you're probably going to get a prescription for pain medication, but it's probably only good for 7 to 10 days. So you will need to follow up with your GP. He will give you that prescription. And sometimes, you know, people go through stages where you think, well, you know, the pain seems to be easing or discomfort, and then you might start to feel it coming back again. That can happen, you know, a while after the surgery, and if you think about it, it makes sense because we've just made an incision, we've cut tissue, but you cut little nerves and things when you're doing that incision. So now they're starting to knit back together. So I always say that's sort of a good thing. You can feel that it's happening again, and that's what should happen, okay? Just in regards to your medication, because many times people want to know, do I bring all my own medications when I come to the hospital? I will say, no, you don't, except if you're on a puffer, we want you to bring the puffers, okay? And if you use eye drops, I would ask you to bring those with you. Just because there's so many different eye drops, we can't have them all. But the puffers also we want you to bring because sometimes anesthesia will ask you to use your puffer before you go into surgery. Okay, so that's just important for you to know. Those are the only two, unless you're taking some very special medication, then speak to the anesthetist whenever you see him, and he will tell you whether or not you have to bring that, okay? When you do come that day, now, also I didn't mention, but usually what you'll find in your surgical envelope there too is there's a sheet in there that will sort of tell you what you're going to be doing leading up to surgery day. So what I'm saying is 2 or 3 days before, make sure you're sort of increasing your fibers so that things are moving better than normal. Also the day before the surgery, I want you to drink extra fluids all day long because that really helps to keep you hydrated, and that makes a huge difference to you when you're waking up after anesthesia. And also now we are mentioning that we want you to drink 3 glasses of apple juice the evening before, and I always sort of say maybe between 8 and 9:30 because that way you have time to go to the bathroom, you won't be up all night peeing. And if your surgery is late in the morning, you could also have some fluids in the morning. I would say get up, have a glass of juice if your surgery is later in the day. Okay, it definitely has to be 4 hours before the surgery time. All right. What else? In the morning, I would just say get up, have your shower, you can brush your teeth, do not swallow anything. You'll take your morning medication as directed by anesthesia or the pharmacist, if you've seen the pharmacist, just with a sip of water. And of course, remember not to be having anything to eat after midnight, okay? Now, as much as we've talked about the surgery and how they can do the surgery, it's important for patients to know what's going to happen in regards to pain control. There's several different things that they can do. Number one, they can do what we call an epidural, which means that you'd be frozen. But if you have that, one, you're going to have a catheter in place, and also you get weaned off of it quite quickly, and we transfer you to what we call a pain pump. So with that pain pump, they're going to give you a little button to press. When you're having discomfort, press the pain pump, okay? And this is really, really important, because when I come to see you in the morning and I say, okay, we're going to get up and we're going to walk, and also I want you to do some deep breathing and coughing, okay? And that's another thing. Sometimes people are very hesitant to do that deep breathing and coughing because they think, are you crazy? This is really going to hurt. We show you how to get around that. Okay, so we'll put a little pillow or a towel over top of the incision. So you have the arm, affected arm on that side right next. Now you're going to take your good arm, hold it really snug, take a deep breath. You'll still feel something, but it's going to be a totally different sensation than if you tried doing it free like this, okay? And that, honestly, please practice that at home, because it makes you aware, like you actually believe us, okay? It does make a big difference, and you should have that sensation. You'll know it then, okay? Another thing that they're going to be giving you is they're going to be giving you this little machine, and they're going to ask you to take a deep breath and suck in. And you'll notice that I didn't get too far up, and neither will you. Not too many people get to the top. Okay, but this is what helps re-expand your lung. So that's the other reason that you folks can practice this at home, okay? Big breath in, cough, all right? That's what's going to help you to re-expand that lung. When your lung is re-expanded, the chest tube comes out, you have your sutures, and you're going to be getting ready now to go home, all right? Now, just another thing in regards to that pain pump. When they give you the little button, you know, a lot of people start thinking, I don't want to use that too much in case maybe I react to it or I have an overdose. As much as we gave you this button and we said you're in charge, you know, the anesthetist sets it at a certain amount. So you don't need to worry about those sort of things. But I also don't want you doing this. I don't want you going along and thinking, oh, I'm just going to wait. I'll wait, I can do it. This isn't going to help you. When you feel discomfort, press your button. Because when I come to get you and get you up and walk, you're going to be able to do that. If I ask you to do deep breathing and coughing, you're going to be able to do that. If you're struggling with, because you haven't taken the pain medication, then you won't want to do those things, which is going to prolong your stay here. And none of us, you know, once you've had your surgery, you want to get better and get home, right? Okay. Also, just while I mentioned the pain medications, if you start to feel any nausea, vomiting, make sure you let the nurses know. That's important. And also, if you notice that you are having any itching or redness around the site where the IV is, make sure you mention that as well. The nurses are very aware of that. You'll be in that unit probably 24 to 48 hours. I mean, technically you go up there for 24 and then you go out to the floor, but a lot of times there just aren't enough beds on the floor, so you might even get discharged from SACU, okay? So you know. Okay, so we're going to say that lung has re-expanded, the chest tube is out. When you're leaving here, you go home with a little dressing over the incision, and that's it. You don't go home with any extra attachments, okay? A couple of things that I want to mention on the way home. Whenever you're leaving here, I always tell patients, don't sit in the front seat, sit in the back seat. Why? If you sit in the front seat and say, I mean, God forbid that you're in an accident or something, but if you were, that bag goes off, where is it going to hit you? Right in the chest. We don't want that happening. And you actually have more protection if you're sitting in the back seat, okay? You can put a little pillow or something over your side too. And the other thing too is common sense in regards to driving, and very often, I don't know, well obviously you guys wouldn't be driving, but you may want to be driving. Usually it's men who ask first, how soon can I drive? And I always say, just use common sense. If you're still taking pain medication, I would say let someone else drive if you have somebody else there. I always say to people, if 5 doctors walk through that door right now, you'd probably get 5 different answers. But common sense is important, using that, okay? I don't think you're not working, but in regards to work, now this is very important too. If you're in a job where you have to, like construction, say you have your own business, you're a mechanic, anything where you're doing heavy lifting, you're definitely going to be off work longer than somebody who has a job where they sit at a computer at the desk, okay? Even nurses, for instance, it would probably be off longer because we have to be able to move patients and stuff. So it's that pulling. And for women, even things like vacuuming, we tell you not to do that for the first couple of weeks. And for men, you know, no lawn cutting or anything like that. That's all important.
Hi, everyone. My story today is a very short one, but it's a good one. In 2006, I was diagnosed with lung cancer. I had a tumor in my right lung, which had to be removed, and they did remove it, and I lost just a little more than 1/3 of my right lung. Now, I didn't need radiation or chemotherapy, but I did see an oncologist for 5 years, and everything has been good up to that point. Then my family physician took over. And every year I have my annual medicals, and they do a chest x-ray, they do the blood work. And this is 2019, so it'll be 13 years in August that I've been cancer-free. So I just want to wish all of you the best of luck, and I hope everyone has a speedy recovery. Thank you.
Okay, just in summary now, it's really important for you to understand. It may seem like there's a lot of simple things that we've been talking about today, but those simple things are very important. Honestly, you know, as far as the surgery goes, we have to take that and put it in a box. The surgeon is going to look after your surgery. But your job is to make sure that you are as healthy and you are doing the exercises as well as you can. Even when you are in bed upstairs in SACU and you're maybe just resting, you can still be doing exercises like this, okay? Moving your arms back and forth, making circles with your wrists, bending your knees up and down, making circles with your ankles. All of those things are very, very important. This can help prevent things like blood clots. The deep breathing, coughing helps to prevent things like pneumonias. So I can't stress that enough, and I will tell you that's what you're going to be hearing when you wake up is deep breathing and coughing, and make sure you're doing your exercises. Okay? So in closing, I wish you all the best, and I guess that's it now. So if you do have any questions, please feel free. Okay, that's it. Thank you very much.